Hi, I'm Ken Johnson, Senior Demographer at the Carsey School of Public Policy and a Professor of Sociology at the University of New Hampshire. And I'd like to talk about my new research brief that was just released this morning. It's available on the Carsey website. So let's get started. This brief focuses on health conditions and the older population in rural America and how that impacts their risks of COVID-19. I'd like to acknowledge the Andrew Carnegie Foundation and also the New Hampshire Agriculture Experiment Station and multi-state project W4001 for funding for this research. And so I want to talk today about the risk that rural America faces and urban America faces because of the COVID-19 epidemic. So when I talk about risks, what I mean here is serious consequences like hospitalization or death. And I'm going to estimate those risks for each county among those infected. So that's an important point. In places where infection rates are lower, even if risks are high, then there is going to be less hospitalization and less mortality. And that's relevant when we talk about rural America. And I've calculated this risk for each county. And I calculated estimates of risk using recent publications from the Lancet, which is a peer-reviewed medical journal. And I take into account the two things: age, and in that I'm looking at age-specific mortality rates from the infection, and then pre-existing conditions, which, you can see the conditions I've mentioned or I've taken into account here. So what I did is created an index comparing each county's risks of these two things to the U.S. as a whole. So if a risk is higher than as the U.S. as a whole, the score will be above 100. If it's lower, it'll be below 100. So this is just a summary of the risk calculation. This is the risk of mortality or hospitalization from age and pre-existing health conditions in metropolitan and non-metropolitan America. And you can see that the risk is higher in non-metropolitan America. That is more, we have almost 32% of all non-metropolitan counties that have a risk above 30% greater than the US average. In comparison, most metropolitan counties have risks that are at or just a little bit above the US average risk. And this is because the population in rural counties is older and because it has more pre-existing conditions. And the risks associated with both age and pre-existing conditions is substantial. There is a considerably higher risk of mortality and hospitalization among older adults compared to younger adults or people in their 20s. And there's also a much higher risk. The CDC estimates that the risks of hospitalization for somebody with a pre-existing condition are about 6 times as great, and the risk of mortality is about 12 times as great. So these are substantially higher risks associated either with an older population or a population with lots of pre-existing conditions. And so here's the pattern of pre-existing condition and age-based risk in metropolitan and non-metropolitan areas. Now, one thing to take into account is that I'm only focusing on the risks from age and pre-existing conditions. There are certainly other factors like poverty, like access to medical care, that are also going to affect risk. So these are not the only risk factors. They're the ones that I'm focusing on here, and they're quite demographically based. If you want to look at this as a map rather than as a graphic, here's the risks pattern in the United States. And you can see areas with substantial risk, particularly in non-metropolitan areas, such as the Upper Great Lakes, Northern New England, in the Appalachians, in the Great Plains, compared to the lower risks in the big urban areas. You can look at Chicago or Detroit here and the suburbs around them. So there is considerable geographic variation in the pattern of risk in the United States. And it's higher in rural areas than it is in urban areas in general. Florida is an exception. This just will give you some idea of this is the number of cases of COVID compared to the US as a whole. And you can see the total US average right there where the blue ends and the red begins. And you can see that there are considerably higher case rates in some parts of the country than in others. Parts of rural America, like in the Southeast and the Mid-South, have fairly high rates, as do the urban areas there. In contrast, much of rural America, including the northern Great Plains and much of the Northeast and Midwest, that is non-metropolitan, have considerably lower case rates. So to some extent so far, rural America has been less likely to be exposed to the disease, and thus the case rates are lower. This is a breakdown giving you some idea of how the cases vary across urban and rural America. And so on the left, counties that have case rates below 500 per 100,000, you can see substantial numbers, 32% of the non-metropolitan counties compared only to about 13% of the metropolitan counties. Now, not all of rural America is spared from cases. You can see on the right-hand side of the graph, 1710 is the average, is the total number of cases per 100,000 people in the United States. So cases above 1710 have higher case rates than the US as a whole. You can see that although those rates are higher, more metropolitan counties are in that high category. There are a substantial number of non-metropolitan counties as well. But in general, the case rates are lower for non-metropolitan counties than they are for urban counties. This is the death rate from the COVID epidemic. And again, the reds and pinks are places where the rates are higher than the US as a whole. The blues, especially the dark blues, are places where the cases are lower. And certainly you can see the primary focus of the early part of the epidemic in the Northeast for the New York metropolitan area and Boston metropolitan area. And then more recently, you can see the uptick in mortality in parts of the South. The non-metropolitan America, particularly the Great Plains, have had relatively low levels of mortality. You do see a few red counties in non-metropolitan America, particularly in the upper Great Plains. Many of those are meatpacking or food processing counties where there are big warehouses and operations that have had significant exposures to COVID. This is the death rates then. You can see that even now, over 30%, about 32% of all rural counties have yet to have a single case death from COVID-19. In contrast, the places where the rates are higher than the US are mostly in the urban areas. So rural America, just like it has fewer cases, also tends to have less mortality than does the urban part of the country. So to this point, rural America has been largely spared from the worst of the COVID epidemic, although it does vary from place to place. There are certainly rural areas that have faced quite a bit of problems. Now, this graphic, which is probably the most important graphic that I've presented to you, shows the coexistence of risks and the current incidence of the disease. So the red areas are places where the risks based on age and pre-existing conditions is the highest, and where there's also been a higher incidence of the disease, more cases and more deaths. And you can see how the South stands out in that regard, particularly the rural South. Again, the metropolitan areas are outlined in black. And also there are many places, particularly in the South, but also in the Northeast, where even though the risks are relatively low, say in a big urban area where there's a younger population and fewer pre-existing conditions, the risks may be low, but the incidence has been high. Those are the pinks. Now, the places that I'm particularly concerned about are the yellow. The yellow are mostly non-metropolitan, you'll note, and they're places that have high risk because of the age and health conditions of their population. They have high risk, but so far they've had a low incidence of the disease. Now, as the disease spreads and infections reach into more and more of America, particularly rural America, these are the places that are significant risk. This 32% of the counties that are non-metropolitan are in this category. That is, they have relatively high risk, but they so far have had a low incidence of the disease. And you can see that many of them are more remote. They're not even near metropolitan areas. And so that's protected them to some degree from the disease. But if the disease spreads to them, the risks are high because their populations are older and they have more pre-existing conditions. So rural areas also are at more risk because they also have higher levels of poverty and more inequality, but also because they have less access to healthcare facilities, particularly the comprehensive healthcare facilities that are needed to address serious conditions related to COVID-19. Almost half of the rural counties have no ICU units at all, so they don't have any centers where serious, sophisticated care is available. And just as distance has, in a sense, isolated them and particularly helped with social distancing, should the disease get to these areas, the risks associated with them is high, and the availability of care is somewhat limited. So risks are higher in rural areas, although many of them have yet to experience high incidences of the disease. The disease is spreading more now in non-metropolitan areas. The number of cases between July 1st and August 23rd, the number of cases in rural America grew by 161% compared to just over 100% in urban areas. And the number of deaths in non-metropolitan areas between July 1st and August 23rd increased by 97% compared to 35% in metropolitan areas. So that protection that had been part of rural America, partially because it is so isolated and so many parts are so isolated and so far removed from the urban areas where much of the early epidemic occurred, that's changing. And so these areas, these yellow areas, are increasingly in jeopardy of being exposed to high incidences of the disease. So as this infection spreads, both rural and urban America is at risk. Anything that disrupts the rural infrastructure puts both rural and America and urban America at risk. For example, we recall from early in the epidemic when the meatpacking plants experienced substantial slowdowns. There were shortfalls of meat, specific kinds of meat, in many parts of the United States. So that underscores the sort of interlinks between rural and urban America. So any solution to this problem, any effort to try and resolve this problem has to take into account the needs of rural as well as urban America. So those are the points I wanted to make. Obviously, if you want more details, you can download the brief that has much more detail, both in analysis and in methods. And if you have questions, I'd be happy to take a few questions now. Thank you very much.
Hi, Ken. This is Laurel jumping in, and we do have a couple of questions. The first is, what implications does the COVID-19 pandemic have for overall demographic trends in the United States and in rural America?
Right, that's a good question. So as you're well aware, the mortality from the COVID epidemic is now approaching 200,000 deaths. The United States right now has relatively low birth rates and relatively high death rates. Plus, it also has relatively few immigrants coming into the country. So the growth rate of the US population last year was the lowest it's been since the flu epidemic of 1919. This year, we're going to have the additional deaths from COVID itself, and as you also know, there are other excess deaths that are occurring because people are delaying treatment for other kinds of conditions or not going to the hospital when they're afraid they're having heart attacks. So that's going to increase the mortality in the United States, which will likely reduce the already low incidence of natural decrease in the United States. At the same time, although it won't affect the birth rates this year, early next year, the birth rates I'm expecting to decline because I think a lot of women are going to say that this is not a great time to have a baby. And so I suspect that not only will we have higher death rates, but we're also going to have diminished birth rates. So, and I can't help but believe that this situation is also going to discourage immigration. And as a result, I expect the population growth rate for the United States next year to be even lower than it was last year. With reference to rural America has even a smaller gap between the number of births and deaths in rural America. And in recent years, rural America has actually experienced population decline for the first time in history. Having more deaths and fewer births, as well as less immigration, is likely to only further exacerbate that situation.
Okay, thank you. And I have one more question. What factors have led to some rural counties having a higher incidence of COVID-19 than others?
Okay. Well, I talked about the meatpacking plant. So any sort of place that has large concentrated activity, whether it's a meatpacking plant or a food processing plant, is going to be one place where there's likely to be higher incidences of the infection and then of serious hospitalization kinds of situations or deaths. In general, the places in rural America that are closer to urban America, that is just beyond the edges of the metropolitan areas, tend also to be places where there are higher rates of both infection and death. In contrast, areas that are more removed from the urban areas, at least until now, have experienced lower incidences of both infection and serious consequences. Whether that's going to continue given how the disease is spreading and the fact that school is going back into session and the country is, at least some parts of the country are opening up more, remains to be seen. Laurel, any other questions for me?
No, that's it.
Okay. Well, thank you very much for joining us. And as I said, you're welcome to download the brief from the Carsey website. And thank you very much.